Good morning, good afternoon, and good evening, dear oral health team members, friends, guests, and like-minded shapers of oral health. I really thank President Corey Youngblood, Executive Director Peter Annas, the Board of Directors, and the entire organizing committee of the International Federation of Dental Hygienists for inviting me to speak to you at this 2021 Global Oral Health Summit. A pandemic could not hold us up from coming together. And be assured, I could not feel closer to you would I stand right in front of you. Let me shortly introduce the FDI World Dental Federation. It's been founded in 1900 and is one of the oldest international health professional organizations. The head office is located in Geneva, which is ideal for interaction with other international health organizations. The FDI World Dental Federation is the global voice of the dental profession and works with its member organizations to improve the oral health of people worldwide. Our mission is to be the worldwide authoritative and independent voice of the dental profession, to promote optimal oral health for all, to promote the interests of our member associations and their individual member dentists, and to advance and promote the ethics, art, science, and practice of dentistry. Our vision is leading the world to optimal oral health, and our vision for 2030 is delivering optimal oral health for all. In a world with half of its population affected by oral diseases, 90% of which are preventable, delivering optimal oral health for all is a challenge that needs to be tackled, starting with making sure that all stakeholders involved into oral healthcare delivery, medical doctors and their team members alike, have a common understanding of oral disease prevention, oral health promotion, and comprehensive oral health maintenance and care. Only then, the way to a productive, pain-free, and quality life for anybody on this globe, no one left behind, will be paved. What was the evolvement of oral health in the last decade, and how did we come to Vision 2030? In 2011, the awareness and appreciation of the impact of non-communicable diseases has raised since oral diseases were included at the first United Nations high-level meeting on non-communicable diseases. FDI's Vision 2020 was presented in 2012, focusing on its fourth key area on mitigating the impacts of socio-economic dynamics, as the global economic and financial crisis has had a deleterious impact on oral disease prevention and oral health maintenance. Universal health coverage target 3.8 of Sustainable Development Goal 3, good health and well-being, had become one of the top priorities within the United Nations since its introduction together with the other 16 SDGs of the UN 2030 agenda in 2015. In 2018, the political declaration of the second United Nations high-level meeting on NCDs failed to mention oral health. The fundamental contribution of oral health in securing general health, well-being, and a good quality of life was also not properly acknowledged. Finally, the political declaration of the United Nations high-level meeting on universal health coverage mentions for the first time oral health on 23rd of September 2019. The emphasis on oral diseases had stopped. The opportunity for FDI was to find a way to help restructure healthcare systems with oral health as an integral and necessary element. FDI's Vision 2030 had become an evident need. The work under the leadership of Professors Michael Glick and David Williams of the Vision 2030 Working Group started in early 2019. It built on the FDI's Vision 2020 document and outlined how the oral health community can tackle challenges and seize opportunities to improve global oral health over the next decade. It was drafted further to a series of workshops with international experts from a diverse range of specialties, including health workforces, non-communicable diseases, health systems, primary healthcare, universal health coverage, etc., as well as consultations with FDI Council, standing committees, members and regional organizations, task teams, and working groups. To avoid the risk of being guided by silo mentality, external experts from other medical specialties, the Food and Drug Administration, WHO, collaboration centers, and governmental departments, as well as partners from industry and trade, were invited to contribute at key stages of its development. In November 2020, FDI's General Assembly approved the Vision 2030 report. To coincide with the WHO Executive Board meeting, FDI released Vision 2030, Delivering Optimal Oral Health for All, a timely report that offers a comprehensive, interdisciplinary roadmap on how to impact health policies and tackle challenges to improve oral health and reduce oral health inequalities over the next decade. We believe the report will be instrumental to member states in their implementation of the commitments laid out in the Oral Health Resolution. On January 18th this year, the opening day of the 148th WHO Executive Board meeting, the report was launched. During that meeting, the FDI signposted the missions through the oral health agenda item, our key asks, and the Vision 2030 resource as a key tool for member states when developing their national oral health strategies and action plans. FDI also gave a statement on the oral health agenda item and mentioned the Vision 2030 report, which was rewarded with words of recognition by the WHO's Director General, Dr. Tedros Adhanom Ghebreyesus. Policymakers often hear parallel voices from different advocacy think tank and research groups, and it becomes difficult for them to ascertain on what piece of information they should act. FDI represents the world's National Dental Association and specialist groups and can effectively provide solutions and a roadmap oral health systems need to be strengthened and how to enhance oral health care. Partnership with other public health advocacy groups like the IFDH will provide the necessary ammunition and recognition to closely align oral health to general health issues and call for unified action. The Vision 2030 report is built around 3 pillars, buttressed by a foundation of supporting educational activities. They contain a solid contribution to the main topic of this summit, the global burden of oral diseases and their economic impact. The answer to the first question, how does your organization approach this problem, is tackled already in the major goal of Pillar 1. And how can the dental hygiene community, profession, education, research, and public policy contribute and collaborate more to reduce this ordeal is taken off in the major goal of Pillar 3. The Vision 2030 report is constructed around 3 pillars, each with a major goal. These pillars are supported by a strategy for education that will create a responsive and resilient profession, which the knowledge and skills to lead systems reforms. To help measure progress towards attaining goals of Vision 2030, a set of targets and indicators is proposed. The document can be downloaded from the FDI website. Let us have a closer look at every single pillar and the foundation. In Pillar 1, we recognize the need for universal health coverage for oral health and to assure that by 2030, essential oral health services are integrated into healthcare in every country and appropriate quality oral health care becomes available, accessible, and affordable for all. The 4 elements to be addressed to achieve this goal are disease prevention and early detection, care close to home, affordable and accessible, better oral health outcomes at lower costs, and convergent platforms for oral health awareness. One of the supporting approaches we have considered in Pillar 1 is to perform health economics research to inform policy for financial feasibility of oral health interventions and establish cost effectiveness and affordability of oral health procedures, drugs, and technology. During our work, we have acknowledged the results from recent investigation. Yevgevich and Listel have looked into investment cases for oral health and found out that if human resources and treatment technologies are carefully tailored, $1 invested in oral health produces $1 in return. And economic benefits of implementing universal health coverage for oral health will outweigh the costs. The cost of inaction instead is $1 trillion of cumulative lost output globally due to oral conditions from now to 2025. Another supporting approach to reach the overarching goal of Pillar 1 is to build a strong cadre of oral health workers, such as dental hygienists and non-physician healthcare providers, such as community health workers, nurses, and other allied health professionals, and enable them to deliver adequate oral health care within their scope of practice, especially at the primary point of care. In Pillar 2, we recognize the need for integrating oral health into the general health and development agenda, and to assure that by 2030, oral and general person-centered healthcare are integrated, leading to more effective prevention and management of oral diseases and improved health and well-being. Such an integration needs to address the shared social and commercial determinants of health, recognized untreated oral disease accounts for a considerable fraction of the non-communicable diseases burden, and implement and enable access to oral healthcare services across healthcare systems worldwide. The achievement of the Pillar 2 overarching goal is supported by reinforcing primary prevention and ensure that individuals are empowered to take responsibility for their own health, particularly through motivational interviewing and health coaching. Dental hygienists are essential team members in the oral health literacy development process. In addition, undertaking research to the health economics of primary prevention is made to test the hypothesis that while dental intervention is expensive, oral health may be cheap. In Pillar 3, we recognize the need for building a resilient oral health workforce for sustainable development. To assure that by 2030, oral health professionals will collaborate with a wider range of health workers to deliver sustainable health needs-based and people-centered healthcare. Such an oral health workforce needs to focus on prevention of oral disease, screen for and monitor systemic health conditions, integrate environmentally friendly and appropriate technologies to benefit patients, and implement oral health resource and workforce planning in collaboration with governments, educators, and oral health professionals. It will be fundamental to foster people-centered care by optimizing the health workforce and enable health workers from all professions to work to their full scope of practice in the areas for which they are educated, authorized, and competent to perform, and furthermore adopt a framework of oral health needs-based resource and workforce planning. The foundation of all pillars is education. We recognize the need for supporting educational activities that are needed to educate a responsive and resilient profession and ensure that by 2030, healthcare professionals will have the knowledge, skills, and attributes to contribute appropriately to the effective prevention and management of oral diseases and collaborate across health disciplines to improve health and well-being. These educational efforts are needed to enhance the focus on evidence-based dentistry and critical thinking, to educate and train oral healthcare professionals to learn how to advocate for oral health and empower patients to take responsibility for their own health and well-being, to provide education and training for collaborative education practice across healthcare disciplines, encourage and implement person-centered approaches to care, and to promote oral health literacy among patients and all healthcare professionals, for example, during the FDI initiative World Oral Health Day, celebrated on 20th of March every year. This year, the World Oral Health Day registered more than 30 billion media contacts. This is almost as much people as there are affected by oral diseases. And last but not least, to engage with industry partners to provide support for integration of emerging technologies in the context of universal health coverage. In summary, the FDI Vision 2030 purpose is as follows: to provide guidance on achieving appropriate, affordable, evidence-based, integrated, comprehensive oral health care for all, to ensure that oral health is included in health in all policies and ensuing health and healthcare debate, to unite all healthcare professionals behind shared goals and aspirations. And these include, but are not limited to, provide equitable, available, accessible, and affordable oral health care to all, integrate oral healthcare within existing and emerging healthcare systems, and enhance collaboration between healthcare disciplines to deliver sustainable, health needs-based, and people-centered care. It's now up to the FDI Advocacy Task Team to go into phase 2 and decide with whom we will develop an action plan and make recommendations to Council on how to operationalize Vision 2030, prioritize activities, and implement it in the frame of the oral health resolution together with the governments of the countries of our member national dental associations. Their engagement will be fundamental to realize the reorientation of the traditional curative approach, which is basically pathogenic, and move towards a preventive promotional approach with risk identification for timely, comprehensive, and inclusive care, taking into account all stakeholders in contributing to the improvement of the oral health of the population with a positive impact on overall health, to which WHO member states are urged considering their national circumstances. Dental teams, the dental hygienist included, can offer a decade-long experience and consistency in oral health prevention and oral health care delivery. Coming to the end of my contribution to this summit, let me share with you a short video many of you know, and which explicitly shows the value of an experienced, functioning, and skilled team ready to carry out operations to reach the goal safely and with a quality attitude at any time and circumstance.
Which engines?
He lost thrust in both engines, he said.
Got it.
Pack is 1529. If we can get it for you, do you want to try to land runway 13?
We're unable. We may end up in the Hudson.
All right, Cactus 1549. It's going to be left traffic to runway 31.
Unable.
Okay, what do you need to land? Cactus 1549. Runway 4 is available if you want to make left traffic to runway 4.
ADX, I'm not sure we can make any runway. What's over to our right? Anything in New Jersey, maybe Teterboro?
Okay, yeah, off your right side is Teterboro Airport. Do you want to try to go to Teterboro?
Yes.
Teterboro, Empire, actually, LaGuardia departure guy, emergency inbound.
Hey, guys.
Cactus 1529 over the George Washington Bridge, wants to go to the airport right now.
Wants to go to our airport. Check. Does he need assistance?
Yes, it was a bird strike. Can I get him in for runway 1?
Runway 1, that's good.
Cactus 1529, turn right 280, you can land runway 1 at Teterboro.
We can't do it.
Okay, which runway would you like at Teterboro?
We're going to be in the Hudson.
County, LaGuardia.
A winning team is one that values appraisal, respect, and trust. I'm grateful to all the oral health teams who have kept up primary and secondary prevention in times of this ongoing health crisis. Your professional spirit and behavior is a winning one. This is confirmed by infection rates in dental practices continuing to be low. You have respected the importance of diagnosis, prevention programs, and treatment plans for individuals meant to contribute to achieve patient-centered oral health outcomes. This is significant enough to make routine dental care a term of the past. The mouth is back in the body. Let's keep it there jointly. I thank you.